Hello, my name is Danielle Lorenz and I am studying to be an emergency medicine physician. I'm originally from Sheboygan County, Wisconsin, and I am a fourth-year medical student at Liberty University College of Osteopathic Medicine in Lynchburg, Virginia. I am currently applying for emergency medicine residencies with the hope of matching in March 2021. I took a little bit of a tortuous path to medical school, with me studying pre-pharmacy in college because I had a knack for chemistry. 3 years into college, I realized that I wanted to pursue my childhood dream of becoming a doctor. Because of my grades and the lack of experience, I chose to get a master's degree in the field of medicine and then became an emergency department medical scribe. After applying to a medical school and being rejected by over 30 schools, I was finally accepted into a school that I absolutely love, and I haven't looked back. Financial stress has unfortunately been nothing new to me. I grew up on a dairy farm, and my parents weren't able to help me out much with college tuition. Despite working several jobs, I still had to take out the maximum amount of government loans as well as some private loans to pay for both my undergraduate education, my master's degree, and now medical school. Any amount of scholarship or grant would be incredibly helpful for me as I look forward to starting residency and starting a family of my own. I chose to be an emergency medicine physician because I want to make a difference in people's lives, and I want to be the beacon of hope to a patient on what is likely the worst day of their life. I've always had a passion for serving my community, and I can't think of a better way to serve my fellow man than by caring for them in their times of need. Being given the opportunity to rotate through several different emergency departments these past few months during the COVID-19 pandemic has really shaped what I think it means to be an emergency medicine physician. The emergency department is full of strong, fearless, and capable healthcare professionals. Being an emergency medicine physician means being a vital part of this team, whether it's leading the team, listening to the other team members, or just helping out. Being an emergency medicine physician means being on the front lines of pandemics, caring for dying strangers, and acting as their surrogate family members when their family isn't allowed to visit. It means holding a patient's hand who's terrified of dying and being the bearer of bad news. It means having to call a 2-hour code on a child who didn't achieve ROSC and having to turn around and care for dozens of other patients in the department. I'm so excited to be a part of this amazing profession and make a difference in my patients' lives. I have several passions in medicine, a few of them being healthcare advocacy and caring for populations who don't have access to healthcare. I've had the opportunity to attend an annual event called DO Day on Capitol Hill, where thousands of osteopathic physicians and medical students speak to their government officials about healthcare policy. I hope to continue to make an impact in healthcare by advocating for my patients in ways such as this. I've also had many opportunities to care for patients who don't have access to healthcare. For example, my school puts on community collaboratives every year with other healthcare professionals to care for those populations in our community. We have nursing students who wash the patient's feet, social workers who connect them with the things that they need and the resources they require, dentists and dental hygienists to offer free cleanings and dental procedures, and medical students and physicians to provide healthcare and prescribe cheap medications as they need. My hope is to take this idea to my future community in the next 5, 10, 15 years and set up community collaboratives in the same way to care for these populations who need it. I hope that in the next 5, 10, or 15 years that I'll be able to make an impact in my patients' lives, my community, and healthcare as a whole. Impacting my patients' lives might look like a patient who finally decides to make that necessary lifestyle change after being cared for by me, or performing a life-saving procedure that gives a patient more time to spend with their family. I hope to impact healthcare as a whole by teaching future medical students in as many capacities as I can. The ultimate thing that motivates me to be a better medical student and a better physician in my future is my patients. Every shift I work, I meet at least one patient who makes an impact on me and reminds me of why it's so important for me to continue to learn and work hard for them. Just the other week, I was a part of a code on a patient who was younger than me. I was given the opportunity to intubate and was even able to jump in on a few rounds of CPR. It was a huge adrenaline rush for me, and it made me so excited to be a part of the team. But after an hour and a half, the patient wasn't achieving ROSC, and the team leader decided to call it. We debriefed and talked about what could have done better to achieve a better outcome. But what could I do as a medical student? Situations like these motivate me to reflect and study harder so that in the future I might be able to get better outcomes on cases like these. We can't save every patient, but I certainly want to be able to go to the patient's family and tell them that I did everything that I could. This drives me to be better by studying and working harder. Thank you so much, FIGS, for your consideration and the time that you are taking to watch all these videos of hundreds of healthcare heroes. Bye.